So what's kind of like the day-to-day of a hospice nurse?
Well, for me, in our inpatient hospice unit, usually take 4 to 7 patients, depending on what shift you work. And you kind of go from room to room and circle around, make sure everybody has what they need, give their medications, make sure their symptoms are managed. If they're having like a pain crisis or something like that, you work really closely with the doctor to get their pain under control. If they're having, if you realize that they're having some spiritual issues, maybe talking about their fear of dying, I will connect with the chaplain and make sure the chaplain knows and make sure my teammates know. Um, and if there's some family dynamic issue, or maybe the patient wants to leave our inpatient unit and live somewhere else, I'll connect with the social worker that we have on site there to kind of help facilitate that process. Um, a lot of it is just really establishing a relationship with the patient, establishing trust with them, being able to be with them during these moments of vulnerability. A lot of them are afraid. Educating the family about death and dying and what it looks like. That's a big part of what we do is education. Most people have kind of the same questions about dying. What does it look like? How long will it take? When should I feed my mom? Should I not feed my mom? So that's a lot of what I do. And it's just kind of circling back and forth between my patients on my shift. Home hospice is different in that you go into patients' homes wherever they are. You can go into a nursing home, or if they live in a bus down by the river, you go there. I've been on a little sailboat before taking care of a patient in their homes, big homes, little homes, everything. So they go to their homes and they have all their supplies in the trunk, the nurse does, and they'll spend some time with the patient, kind of navigating their medications, making sure they have what they need medication wise, make sure their symptoms are being managed. You know, we listen to the heart, the lungs, the whole, physical assessment, make sure they have everything they need, and then collaborate with the team as well. Hospice is a very team-centered approach to dying, because dying is a spiritual, emotional, and physical event. And so that's why we have social workers, chaplains, home health aides, nurses, doctors, volunteers on the team. It's really important to reflect on your spirituality or your religion, whatever it is to you that gives you meaning, where you can kind of integrate your work life and your spiritual life. It makes it your job more fulfilling that way. And I love that you Peter, kind of came to terms with your experience of what it will be like to die for you, and how you could come to a place where you found peace so that you could actually help your patients, through this process.
It's just in some cases, no matter how much you try, no matter how good of nursing care you do, sometimes people it just have to leave this earth, and it's no one's fault. It's no one to be blamed, and it is because it's been made to be that way. We don't live forever.
We don't.
Is there like a good approach to speaking to somebody that's going through like end of life?
Encouraging life review. You were asking them questions, which is a really beautiful part of the dying process and a really important part, to be able to kind of look back on your life and go, oh, like that sunset in Hawaii was so amazing. Or, I raised my daughter and she's, a teacher now, and whatever it is, anything that gives them meaning. But life review is actually really important. So if you can kind of ask questions about that. Also, I think it's really important just to ask them, what is really important to you? A lot of times with my patients, even when they're close, maybe a week away, I'll say, what's really important today? Do you want me to call one of your family? Do you want your friends over? Do you want a milkshake? I think it's important to recognize that this is, they're on a timeline here. You don't necessarily have to say it, but they're on a timeline. So let's try to make the best of it.
If you want to watch or listen to our latest episode,
You can check us out on Apple, Spotify, or watch us on YouTube.